Welcome to Beautiful Nurses Magazine, the first magazine to merge beauty and fashion with healthcare, a feel-good guide to health and wellness. Beautiful Nurses Magazine is not just for nurses, but for anyone who nurses the soul. We are so glad to be here today with
Dr. Sarepta.
To see her beautiful, hear her beautiful, and show her beautiful to you. Stay tuned for more with Dr.
Sarepta.
Dr. Sarepta. So Dr. Sarepta, tell us a little bit about yourself.
Okay, well, I am a native of New York, New Jersey, I like to say. I've been here in Atlanta for 4 years now.
Okay.
Graduated residency in 2015 and just came on down to start my practice. I've been in private practice for 3 years.
Awesome.
Crazy enough to start a practice a year after getting here to Atlanta, and it's been wonderful. I'm a specialist in the foot and ankle podiatry.
Okay.
Enjoy that very much, and other things, endeavors that I've been able to go on since getting here.
So that's a pretty big jump. New York, the North, you're a Northern girl.
Northern girl.
Coming all the way to Atlanta. Now you're a Georgia peach. Was there any particular reason why you came to Georgia?
Oh, just nothing really in particular. I think just for a change of environment. I guess truthfully, I have not discovered the reason yet. I can't, but I can see it developing. I can see the purpose is becoming clear. So although, and people ask me that question, well, why are you here? And I say, well, I can easily say I got a job here when I first graduated,
Right.
But I think it's more than that. I think it's just purpose and destiny.
I agree with that too.
Yeah.
And sometimes when you get that voice, and I call it for me the God voice that says,
That's right.
I think you need to go this way. You don't always know the reason,
Right.
But it turns out for the best.
Right.
You find your purpose.
That's right. And it becomes clear.
Absolutely. Welcome. So what led you towards your brand? What had you start that outside of what you do every day as a living, for a living as a doctor?
Well, it really stemmed from really in residency. During my clinical practice, I, just was going through the motions, of learning medicine and meeting different patients. And it just sort of occurred to me that a lot of people that I was encountering really did not understand their condition. It was really the need that I found for education.
Yes.
That people really, there was a lack of understanding as it pertained to their health care.
Yes.
And so patients would come in, they would come in and see me, they would get their prescriptions, they would, engage with me, but they would leave, and I would sense that there was something missing, right? And so, I kind of battled with that during my first year of practice, trying to determine how could I reach these patients, what a greater impact that I can have in their lives, aside from just the 15-minute appointment slot that they had with me, and out of that came Serenity Health Talks, a platform that I developed to sort of engage better with my patients and non-patients alike.
Absolutely.
Just to help them better to understand their health care.
Absolutely. I love that. That's beautiful.
Yeah.
Beautiful Nurses Magazine is a magazine for all people. However, being in healthcare, we understand that the health disparities that we see affect minorities, the Black community, poor people, disproportionately.
Right.
One of the things that we've been focusing on at Beautiful Nurses Magazine is how can we help the community, especially those within the urban and Black communities, poor communities, bridge that gap. When it comes to health and African Americans, Hispanic Americans, how do you bridge that gap as a doctor with having them understand how important their health care is? How do you feel about that topic?
Sure.
Primarily focusing on the Black community, but how do you feel about that? Let the audience know how you feel about that.
Well, I absolutely agree with you. There is a great disparity. There's great disparity amongst different communities when it comes to healthcare, not just accessing healthcare, But even before that, I think understanding healthcare. And I think from a provider's standpoint, and it's something that a mission and a goal of Serenity Health Talks is to sort of bridge that gap through education.
Yes.
I firmly believe that education is a key factor.
Yes.
In sort of diminishing the disparity.
I like that.
Because
Beautiful.
I find that when my patients understand, or in general, right,
Yes.
because we're all our patients at some point, one point or
Yes.
another, when we understand our conditions, our disabilities, or whatever we're, challenged with, when we understand them, we're more compelled to better take care of them.
Yes.
We're more compliant,
Yes,
right?
we
When we
are.
can have a conversation with our doctors.
Yes.
It's different than when you just go in and a doctor or a nurse just kind of tells you do this and do that, and
You
you're
really
thinking
don't know why, but you just do it because they said do
you
it.
have no idea. And
No
you're thinking
idea.
when you leave, you're going to try to read the paper and figure it out. You don't want to admit that you don't know, right? You don't want to admit that you don't understand really what diabetes is, although you've been diabetic for 10 years,
Yes.
and right? And so I think education is key. So providing, from a patient standpoint, getting education in the resources and admitting what you don't understand, right?
Yes. And what you don't understand.
Absolutely.
I like that.
And from a provider standpoint, be willing to relate to the patient that way. Really
Yes.
taking the time.
Put yourself in their place. Meet them where they are.
Meet them where they are.
Yes.
Right? Get rid of all that. I try to, in my practice, I make it an effort to get rid of all that big talk.
Right.
Just talk the basics.
Yeah, talk the basics. And that's what you're doing, and that's what I like about you.
Yeah.
And I like about your beautiful, and I like about, that's what I like about what you're doing with Serenity Talks and the other initiatives that you have. So you heard her. Make sure you ask the questions.
That's right.
Make sure you are educated and intelligent on what's going on with you.
That's right.
And if your provider isn't making you feel comfortable, make sure you people should know that they have other options.
That's right.
And sometimes communicate with your provider,
Sure.
Thank you for that. Thank you.
You're welcome.